We're delighted to announce the launch of a new clinical community on CardioSource that is for chronic angina. We're delighted to have Dr. Julio Panza as the editor of this clinical community. He's from the Washington Hospital Center and joining today from Heart House. So Dr. Panza, I want to ask you, how did this community come about?
Well, as you know, Chris, there's been, I think, a shift in the focus from acute coronary syndromes, which I think has been the dominant theme in cardiology for the last couple of decades, to more to stable coronary artery disease, and issues that we thought that were settled and not to be challenged now have come into light as ones that actually need to be tested more rigorously. I think that this is highlighted by the new guidelines that just came out, as you know, literally several weeks ago. So this is, I think, a very timely topic for discussion.
Well, it's terrific. Now, what types of patients will be addressed here? Will it be stable angina, namely symptomatic patients, or stable coronary disease, or both?
Both. So this is supposed to be very encompassing of the different presentations, symptomatic or asymptomatic, of a stable ischemic heart disease. We will not address acute coronary syndromes, but we plan to feature some issues about prevention and certainly treatment or treatment strategies for these patients.
Well, it's a terrific thing, and as you note, the acute coronary syndrome is about a day in the life of a patient in hospital, sometimes 2 or 3, but the stable phase is really measured in decades, so this will be very important to get all the treatments right, and certainly a lot of advances as noted in the guidelines. What kind of features will you have in the clinical community?
Well, we'll start with an article of the month, and that, of course, will repeat and will be renewed every month, and then a case challenge. And for the first issue, we tried to relate the two of them. And the article of the month will be a discussion on the FAME2 trial that, as you know, has been a very important trial published last September. And the case challenge will feature a typical patient with chronic stable angina that presents to a cardiologist for consultation, and different options as to how one would approach the evaluation and treatment of this patient.
Well, it sounds terrific. And then obviously we'll have all the journal scans and trial summaries that relate to stable disease and angina as well, feeding the community. And hopefully we'll engage all of you to participate, comment, take the case challenge, and this will be a vibrant new part of CardioSource. So welcome aboard to the new community.
Thank you so much, Chris. We certainly hope that this will create the forum for discussion about this very important topic, because, as you alluded to, it refers to a very long part of patients' lives.